guys, welcome to Didactics Online. We're going to do a quick video on pelvic treatment today. So if you have any questions about pelvic diagnosis, we have another video that you can definitely find on the website. So we're going to start with treatment. I'm going to have Randy lie down on the table. By the way, this is Randy and I'm Tara. Okay, so we're going to start with rotations. There are two types of rotations, anterior rotation or posterior rotation. So if we had an anterior rotation, we would have findings of the ASIS being lower in front and the PSIS being higher in the back on that side. So if it were on the right side on Randy, he would have it tilted forward like that. Treatment, we're going to do all muscle energy treatments. So treatment for an anterior rotation here would be to pick up his leg into flexion and take it all the way to the barrier. We're going to have him do an isometric contraction against me going this way. So push against me, okay, relax. And then after each isometric contraction, we would push into the new barrier and have him contract again. Good, relax. You hold 3 to 5 seconds each time, and you do it 3 to 5 times. Push one more time, and relax. Pick up the slack, and bring the leg back down passively. So that's for an anterior rotation. If we had a posterior rotation, he would have a ASIS that's higher on that side and a PSIS lower on that same side. So for that one, I would have Randy scoot towards the edge of the table, and I'd bring his leg off the table. I'm going to stabilize at the opposite hip just to keep him on the table. And this we're going to do the same type of treatment. It's a muscle energy, so I'm going to have him push up against my hand once I'm at that barrier and relax. Pick up the slack one more time, 3 to 5 seconds, and relax. And again, push up, 3 to 5 seconds, and relax. Push into the barrier one last time, and bring his leg back up passively. Okay, we're going to get him back on the table so he doesn't fall off. Aside from rotations, we also have shears. So you can have a superior shear or an inferior shear. With a superior shear, the ASIS and PSIS would be superior on both sides. A treatment for that would be to gap the joint, so you're going to abduct the leg, you're going to internally rotate and add some traction. You're going to hold that position for a little, like a few seconds, so you get it nice and loose, and then you're going to pull it into that traction and then bring it back. Your force would probably be a little bit stronger than what I just did, but I don't want to give him a dysfunction, so I took it a little bit easy. If you had an inferior shear, that would mean the ASIS and PSIS are both inferior on that side. So for an inferior shear, Randy, you want to show them what you do? You just hop on that leg. But you want to make sure you don't let the knee bend. You want it to end up stiff on that leg. Okay, back on the table. So we can also have in-flares and out-flares. To treat an in-flare, since it's tilted in, since you would have one ASIS closer to midline than the other side. So to treat that, you're going to bring the leg out. Your pants are a little tight. Don't rip your pants. We've done that before. You're going to bring the leg out, and you're going to have the patient put an equal force towards the other side. So push in and relax. Pick up the slack, push in again, 3 to 5 seconds, relax. Pick up the slack again, push in, and relax. Pick up the slack one last time, bring it back to midline. So that was for an in-flare. For an out-flare, you kind of do exactly the opposite. So if his ASIS on this side were further away from midline than the other side, I would bring his leg in. So what I would do is, I would kind of hold this as, just to make sure the hip doesn't come off the table, push his knee towards midline and have him push out against me. Same thing, isometric contractions out, have him relax after 3 to 5 seconds, push in towards the barrier, have him push towards me again. And relax, one more time, 3 to 5 seconds, and relax. Pick up the slack one more time and bring his leg down passively. So that's all the treatment for pelvis, and let us know if you have any questions on the comments, or comments on the comments.